Valley Immediate Care is performing viral and antigen testing for anyone who would like to be tested. Joining us now is Brent Kell from Medford, who is the Chief Executive Officer at Valley Immediate Care. Thanks very much for being with us today.
Thanks, Brian. Good to see you.
Good to see you too. Tell me a little bit about the tests you're providing, who benefits from them, and why should people get them?
Okay, so two different tests. One is an antibody test. An antibody test is kind of looking in the rearview mirror. We're hoping to see if people have developed antibodies to COVID-19. The idea is that hopefully that there is some protection involved with those antibodies. We don't really know enough about that yet. So the antibody testing is somewhat useful maybe in determining from an epidemiology standpoint whether the virus has been here in any great numbers. So far we've tested over 700 people and our positive rate is way under 1%. So our opinion, at least at this point in time, we haven't seen the virus here in large numbers yet.
And the other test, what does that look at?
The other test is a PCR, and that's a nasal swab that goes off to a lab. We're using LabCorp currently, and that tests for active infection. So we're talking to lots of employers now about the idea of using PCR as a way to return people back to work, maybe industries where they're high touch, hair salons, physical therapy offices, positions that you can't really social distance yourself 6 feet. So we also test, I'm sorry?
No, I was going to say, if someone is walking into your facility, should they get the antigen test or get the other test to see if they're actively involved?
Active test is much more important, probably. It's interesting to know, have I been exposed? Was that illness I had back in February really COVID, or was it something else? But really, the active testing is moving forward. I think we're kind of moving more and more towards active testing. Some localities now, like the state of Alaska, if you fly into Alaska, at deboarding the plane, you're supposed to show evidence of a negative PCR test within the last 72 hours. So we're starting to do lots of those tests also.
If someone makes a decision to have one of those tests, how do they get into your facility? Do they need a doctor's referral of some kind?
Negative. No, they can just check in. We're asking everybody to check in online right now so we can kind of space people out and keeping our waiting room empty and trying to cross-expose people as much as possible.
Now, if someone has symptoms, should they come to your facility and get tested?
If they have symptoms, they should probably connect to us via telemedicine. We have a telemedicine application now that they can contact us via text or email. We'll set up a Zoom meeting much like this, screen those folks, and then in some cases send them directly to Asante or SysQ to get collected directly and keep that at home away from folks.
Of the folks, I know you mentioned you knew what your positive rate was for the antigen test. Do you know what the rate is for the active test, and should we be concerned about those numbers as well?
As far as the accuracy rate? Mm-hmm. Both tests are under fire right now. New England Journal of Medicine came out blasting PCR testing. Antibody tests have been under suspicion for cross-contamination with other coronaviruses for years. The fact is, it's the best we have right now.
Are you concerned, as we see the spike in cases around our area, about the safety of your staff as well as the clients who might come into your facilities?
No question, no question. We're kind of in a new position. We see this every year. It's called influenza. And so we're used to dealing with infectious disease. We protect ourselves, we protect our patients, we're cleaning waiting rooms constantly. So we're kind of used to dealing with this. It's not as, influenza is typically not as bad as corona, but we're set up for it.
If someone comes to your facility, do they need to make a reservation? Do they call ahead? Do they get an appointment? And how do they protect your staff and themselves?
Yeah, so for our staff, check in online. It spaces everybody out. We know we're coming. We're constantly looking at those check-ins. You're supposed to give a reason why you want to be seen. So we're constantly patrolling those for any kind of COVID-type symptoms. We try to turn that visit into a telemedicine visit. If for some reason they're symptomatic, they need to come down for a chest x-ray, then we ask them to come down, stay in their vehicle. They then text us when somebody comes in and escorts them into the x-ray room, back out of the x-ray room, really minimizing exposure.
Brent Kell with Valley Immediate Care, thanks very much for making time for us, which I'm sure is a busy day for you. Thanks again.
Thanks again, Brian.